my name is Dr. Anton van Heerden. I'm one of the senior eye doctors here at the Royal Victorian Eye and Ear Hospital. An appointment has been made for you to see a specialist eye doctor, also known as an ophthalmologist. They'll determine if you have a cataract and to discuss possible treatment. While you're waiting, I'd like to talk to you about what a cataract is and what we can do to help improve your vision. So cataract is the clouding of the eye's lens, which may result in poor vision. Most cataracts form as a result of aging and long-term exposure to UV light. In the majority of cases, cataracts are treatable. Your ophthalmologist will examine your eyes to see if you have a cataract. If you do, they will recommend a treatment plan. This could be either a new prescription for your glasses, just monitoring your cataract, or surgery. If surgery is needed, a consent form is completed and an appointment will be made for surgery. If you need surgery, you're in very safe hands. It is a simple procedure with very few risks. Cataract surgery is one of the most common procedures performed here at the Eye and Ear Hospital. In fact, it's one of the most common procedures and safest surgeries in the world. The aim of the surgery is to improve your eyesight. We hope to give you good distance vision, however you may still need glasses to read. The cloudy lens in your eye will be replaced with a new synthetic lens called an intraocular lens or IOL. Cataract surgery is effective and safe in about 98% of patients. We operate on one eye at a time due to a small risk of infection, which is minimal at about 1 in 2,000 cases. If both your eyes need surgery, you'll be given another date for the second eye to be done. The risk of complications are minimal. However, some patients report irritation, redness, grittiness, or bruising of the operated eye. Some see halos around lights. You may have temporary double vision or floaters, which are moving shadows. All of these are usually minor and will improve with time. The more serious issues after cataract surgery affecting small numbers of patients include surgical complications which may require a second procedure, swelling of the macula, severe infections, or even a retinal detachment. This is not a complete list, but these types of complications may require further treatment and in the worst case scenario may cause vision loss. As I said, these are very rare. Before the procedure, you will require a pre-admission assessment. This may be an appointment at the Eye and Ear Hospital or a phone call from one of our staff where we'll tell you when to stop eating and drinking before surgery and which medications to take or stop. If you do not complete the assessment, your surgery may be cancelled. At admission, the nurses will take your history and ask about any allergies you have or medicines you take. They'll also administer eye drops to dilate your pupil. The surgery will be performed in the operating theatre. An anaesthetist will give you an injection of local anaesthetic around your eye. Throughout the surgery, you'll feel pressure, but it should not be uncomfortable or painful. Please be aware, the doctor you see in the specialist clinic may not necessarily be the doctor performing your surgery. On the day of the surgery, you'll need someone to take you home after the surgery as you can't drive yourself or catch public transport after surgery. You will be prescribed eye drops after the surgery. Please use the drops with clean hands as directed and bring them to your follow-up appointments. You'll go home wearing an iPad and shield. The iPad can be removed the day after surgery, but the shield should be worn while you sleep for a week. Light activities and work can usually resume once the iPad has been removed. Do not drive until your vision has been assessed by a doctor or optometrist. A follow-up appointment will be made for you 3 to 4 weeks after your surgery. I hope I've answered most of the questions you may have about cataracts and cataract surgery. If we recommend that you need surgery, you'll be given a handout to take home with you which explains the procedure and the risks and benefits. We also have another video explaining the anesthesia for cataract surgery which you can watch on our website. Please speak with your doctor if you have any questions. We're here to help. Thank you for watching.